initially tried to do a Gates and Ramp matchup as a congratulatory effort, but Dr. Ramp and Dr. Stanley are in an X-Lap right now, so we were foiled. Dr. Major has stepped in. Huh? Oh, really? You just made that? Sounds better. So anyway, this is go like normal Jeopardy. There's 2 rounds. We're not going to double the points on Double Jeopardy because this program does not let us do that. So they'll all be worth the same amount of points. Dr. May and Dr. Morin will help me as spotters and point makers. So due to seniority privilege, we'll let the chief team go first. In the first round, our categories, number 1, surgical instruments. Basically, there's a picture of an instrument. You have to tell us what it is. Second, who knows the answer? Autoantibody. This is about associated autoantibodies with different disease processes. All about ulcers. Very self-explanatory. Eponyms. These are different eponyms that you have to name, named after people. And then there's a thing about trivia about Chattanooga, Tennessee. So we'll let the chief group go first. If you know the answer, hit your child percussive device. And the first one to ring will get the points. If you get the answer wrong, you lose the points, just like Jeopardy. So we'll let the Chiefs go first. For 500, name this instrument. I didn't think this one was that hard. Chiefs. It is a McGill forcep. That's true, he did. Is it a McGill? That is correct for 500 points. You have control of the board.
Instruments for 400.
Surgical instruments for 400. Oh, shoot. I don't know how to. Okay, you see it like that? There you go. That's what you get. Yep. That is correct. All right, you now have control. For 500 points. What is the oldest restaurant in Chattanooga? Yeah, well, it's in my head. All right, 5, 4, 3, 2, 1. Zarzer's Cafe. It's 1906, I believe. All right, you still have the board. Huh? For 400 points. Who performed the 1941 hit song Chattanooga Choo Choo? We start with the hard ones. They get easier. Anybody? Does anyone give up? Glenn Miller and his orchestra. All right. 300. Y'all are crushing this category. 300 points. Into what river does the Tennessee River empty? All right. False. Oh, Triangle? Yes, thank you. Ohio River is correct. 300 points. You've moved into second place. All right, you now have control of the board. For 200 points.
That's just random and weird.
It's their prerogative for 200 points. What is associated with antimitochondrial antibodies? What disease process? Triangle. Oh.
You said sclerosis.
Kind of like cirrhosis.
Sorry.
Don't do it.
Oh. Alex would say
You did say. let you slide one time. Because I'm a nice guy. You were closer to anyone else. If you, well, you had a questionable question. All right, again. All about ulcers for 300. What types of gastric ulcers are due to acid hypersecretion? Symbol.
What is type 2 and 3?
That is correct.
I mean, those are good teams.
Yeah, team names are your instruments. All right, you can go again.
Let's do surgical instruments 300.
Surgical instruments for 300. Again, yep,
Was it deeper?
that is correct. Moving into the lead. All right, control the board is yours.
Surgical instruments 200.
All right, for 200 points. What is this? Correct, although it's actually spelled Wheatlander. I didn't know that until I made this. And that gets you up to 1,000 points. And you get to pick again. Clearing out surgical instruments.
Was it baking?
Correct. All right. No more pictures. The picture ones are gone. For 500 points, where would you find a Martorell's ulcer? Dun. All right. Incorrect.
What was the answer, so we know it's not?
Not in a gastrojejunostomy. Anyone else? Anyone? All right, time has expired. It's in the leg. This is caused by diastolic arterial hypertension. Actually, I don't think it was. It was on a website with a list of eponyms.
That's exactly where I want to get my surgery.
Yeah. All right, you still have control of the board, however, with a costly error.
Ulcers
For 400 points. An aggressive tumor rising from a chronic wound or burn.
No, so it's not.
Symbol.
That was marginal.
He said margolin. He said margolins. So you didn't use a form of a question. That's your freebie. It's now gone. Everyone has now utilized their freebie. All right, you have control.
Let's do Chattanooga trivia 200.
All right, 200 points. What three mountains are visible from the roof of Erlanger?
What is Raccoon Mountain?
No.
Where's our
If no one else gets it, I may utilize a freebie.
Triangle.
Did you triangle? You gotta like hold it. No. That's definitely wrong.
What did the chief say?
They said Raccoon Mountain, which it's Elder Mountain, which is an extension of Raccoon. So, with all the complaining, you have a freebie. No more freebies. You got the point. All right, freebies are done. You have control.
Eponyms 500.
For 500 points. Veins overlying the pylorus. Correct. Go again. For 200 points. An ulcer in a Charcot foot is due to what? There are two acceptable answers here. What disease process? Yes, or peripheral neuropathy from diabetes. Yes, correct. Go again.
Who knows the answer for 500?
For 500 points, anti-smooth muscle antibody is found in what? Three, two, one. Anyone? And chronic autoimmune hepatitis. Sounds like that's not what you were discussing, so that's good. All right. You still have control.
Same category for 400.
For 400 points, anti-gliadin IgA, anti-entomysial, and anti-transglutaminase. I heard symbols first. No. Triangle. Correct. Celiac disease. All right. And it's you now.
Ulcers 100.
For 100 points, gastric ulcer caused by head trauma. Triangle. Correct. Cushing's ulcer. Ulcers are cleared out. You,
I make a motion that if we can't hear their answer from here, you deduct their score because nobody in the back of the room has any idea what they're saying.
okay.
So they
Speak
have to
loudly.
speak up or we deduct their score.
I like that.
Okay.
Antibody 300.
For 300 points, antithyroid peroxidase and antithyroglobulin. You got to hit the symbol better than that. Symbol.
Grapes. What is grapes?
No.
What is Hashimoto's thyroiditis?
Correct. All right, back to you. No one likes my eponyms.
For 400.
I thought this would be the least popular. 400? DVT caused by compression of the left common iliac vein, but simple team.
What is May Turner?
May Turner is correct.
Yeah.
All right. I mean,
We'll chalk that one up to an accent. All right. All right, it's up. You're bored again.
Do 300.
Eponyms for 300. Toxic epidermal necrolysis.
Coumadin.
Just wrong. No, not a question. Wrong.
what is Stevens-Johnson syndrome?
Correct. Stevens-Johnson syndrome is the answer. It's kind of cheating because
I did tambourine.
Brand name.
eponyms for 200. Palpable umbilical nodule in the setting of abdominal malignancy. You shaking the shaker.
Sister Mary Joseph's name.
What is a Sister Mary Joseph's node or nodule?
Sister.
They said sister. All right. A lot of big points still left on the board. Autoantibody for 100 points. Rheumatoid factor is associated with what disease?
Rheumatoid arthritis. What is rheumatoid arthritis?
Correct. Trebek lets people slide if they fix it quickly. All right. All right.
No, you did 300. You've almost lost it.
you could end up with 100 at the end of this. Pick between these two. For 100 points, test to check for palmar arch by compressing the radial ulnar arteries. Chief team.
Nope, can't hear a damn thing.
Oh! 100 points.
Way to go, Capote.
Them's the rules.
Trivia.
All right, speak loudly. Official nickname of Chattanooga is?
What is Chattaboogie?
Say it loud.
What is the Sing City?
That's correct. All right. at the end of one round. Team 1 with 1,300, Team 2 with 400, Team 3, Team Symbol, 1,700. No, but I can just go here real quick and.
Make sure you get that 300 in there. You don't have to do 300.
400, buddy. What were y'all? 18?
The finger's getting tired with ours.
17. Yeah, Smith rules. You lost one. All right. This is the second round of Jeopardy. Our categories are OR radio combos. This is a combination of something you find in the OR with the last name of a singer or artist. You'll start with 100 and maybe you can figure it out. Number 2 is Suture Self. This is all about sutures. Next category, What the H. This is all the answers will begin with the letter H. Fourth category is Here's Your Sign. These are common physical finding and radiologic signs. And 5 is Finish the Lyric. Songs that you hear all the time in the OR, how closely are you listening to the words? Songs that you hear all the time. So I think y'all actually you're in last place, so you get to pick first. For 100 points. Yes, there were times, I'm sure you knew, when you hear this with Dr. Mejia all the time. Yeah, what's the next line? Ooh, we may not do well with this category. Nobody knows? This is from the classic Frank Sinatra song, My Way. There were times I sure knew when I bit off more than I could chew. Probably comes on in Mejia's OR more than any other song. Okay. Next.
Let's do OR radio combos for 100.
For 100 points. Again, so this is going to be the instrument melded with the name of the artist. Straight Needle, Blue Ain't Your Color, which is a country song.
What is Keith Urban? Who is? What is it?
You're on it.
Keith Needle.
Keith Needle Urban, yeah.
Oh, I see.
Correct. You were there. Yeah. So now you kind of get it. You got it? Okay. All right. Board's yours again.
Radio combos for 500.
Okay. An instrument for scraping and debriding tissues, and Friday I'm in Love, which is a rock song. Five, 4.
The Cure? The Curette? Oh, that's it.
Correct. You're almost in 4 digits. Good call. All right. Go again.
Let's do OR radio combos for 400.
For 400 points. A clamp with sharp teeth used to graft soft tissues, and who performed Man in a Box? Symbol.
What is Allison James?
That is correct. All right.
OR radio combos 300.
You're making up a lot of ground here. An absorbable monofilament suture and thriller. I thought this would be one of the easier ones. Think rhyming. Anyone? I think y'all are probably all around it. 3, 2, 1. All right, time is up. It was Monochrome Jackson. So Michael, that one's a little tough. No one lost any points. I don't want to hear it. We're moving on.
We'll go OR radio combos 200.
For 200 points, a large blunt clamp since you've been gone. Ooh, who? Yeah, I think the symbols had it. Huh?
We rang it first. and you
Did they ring?
didn't.
Who? Spotter?
Yours was definitely louder.
Hit it like you mean it.
Yep. I heard the cymbals. What did you say?
Cymbals are inherently louder.
You chose.
Look, hold the little rubber band and hit the crap out of it. Yes. You were correct. Kelly Clarkson Clamp. Kelly Clamp Clarkson, whatever. Okay. Board is yours. I gave it to you already.
Finish the lyric. 500.
For 500 points. Tonight we're fighting in a losing war. Don't even remember what we're fighting for. Running on hope and gasoline. Got a real bad feeling. Again, commonly heard. Dr. Moore. Dr. Moore knows what it is. No one else does.
Do we need the artist to have lyrics?
Huh?
List the lyrics, right?
List the lyrics. No, you have to say what the next line is. Nobody's going to do it. We give up. Got a real bad feeling. It's a pipe bomb dream. It's Turnpike Troubadours. All right. We're 0 for 2 and finish the lyric.
Finish the lyric 400.
For 400 points. Hey, man, you talking back to me? Take him out. Symbol.
Keep them separated. What is you gotta keep them separated?
Correct. By the Offspring. Common Maxwell song. All right. Yours again.
Suit yourself for 500.
For 500 points, name this type of suture. Chief team.
What is a Gamby stitch?
Correct. Or, yeah, Gamby stitch. That was probably actually the better term than suture. Go again.
Suture for 400.
For 400 points, what is the smallest available suture size? Triangle.
12. What is 12?
Correct. 12-0 suture. Your board is now yours.
Feature for 300.
For 300 points, the first synthetic suture commercially available other than cotton, silk, and catgut. So we're not synthetic. Yeah, it's real cheap.
Proline.
False. You had 300 points to lose. Anyone else? Time's running out. Time's running out. Time is up. Nylon. Which I wouldn't expect you to know off the top of the head. That would have been a good guess. All right. Who job? Charles, yeah. For 200 points, what are the 3 types of points you can find on a needle?
What is cutting? Sharp. Or cutting, blunt, and taper.
That is correct. Sharp.
What is pointy?
Not quite as pointy. All right. Team symbol.
Let's go what the H for 500.
For 500 points. I couldn't figure out how to make it double, so they're just the same. Ligation of the femoral vein to prevent pulmonary embolism in patients with DVTs. We don't do this so much anymore. This was the classical procedure to do that. Anyone? You're not going to get this. I'm just going. That was called Homan's operation. Seems extreme to me, but all right, go again.
Let's do, here's your sign for 200.
For 200 points, the inability to take a full breath with right upper quadrant palpation. Ooh, which one?
I think it was triangle.
Think it was triangle?
When's Murphy's sign?
Correct.
No way.
What?
Hey, I'm relying on my spotter for that one. That was close. All right, you have the board.
Here's your sign 300.
For 300 points, This is seen in acute pancreatitis. That was clearly symbol.
What is colon sign?
That is correct. Board is now yours.
500.
For five, here's your sign.
Yeah.
For 500 points, dermal hyperesthesia at the inferior border of the right scapula in cholecystitis. Not one of the more common ones that we use. Anybody know? All right, time is up again. That is Boaz sign. So we got 2 gallbladder ones. We're 1 for 2. All right, go again. I guess it's y'all again. Here's your sign for 400. Fibromuscular dysplasia has this appearance on angiogram. I'll give it to you. It's string of beads or string of pearls sign. Okay. It's yours again, symbol team.
Let's go with H100.
For 100 points, resection of the sigmoid colon closure symbol.
What is Hartman's?
Yeah, what is a Hartman's procedure? Correct?
These things are great.
I need those back at the end. My daughter's going to miss those if I don't get those back. Incidentally, I was really excited when my mom got her that for Christmas. All right, go again.
What's the H for 300?
For 300 points, surgical division of the lower esophageal sphincter. Symbol,
What's a Heller?
louder.
What is a Heller myotomy?
Correct. It's borderline. Okay. Board's yours again.
100.
For what?
Oh, here's your sign.
Okay. For 100 points,
What is company size?
correct. Would have also accepted bent inner tube sign. Sigmoid volvulus. Good job. All right. You get to pick again.
What the H200?
All right. For 200 points, pyloroplasty with a longitudinal incision and transverse closure. Symbol,
What is a Heineke-Mickelwood?
correct. Heineke-Mickelitz pyloroplasty.
400.
What the H for 400? Another name for a radical mastectomy. The eponymous name of a radical, not modified radical. Triangle,
What is Halsted?
correct. Halsted operation or Halsted procedure. All right, it's back to y'all. Suture yourself for 100 points. The Chattanooga choice for suturing in a chest tube. Symbol.
No. No. Say 2.
He did say 2-0. You're right. You would have gotten it. I'm giving it to you.
Whoa. He said 2-0.
He said 2-0. That is 4 sizes smaller than the correct answer.
You gonna give it to them though?
What? I shook it.
They pointed it out.
I'm sorry I messed up, but given the eruption from the front row, they were gunning for it pretty quick. Number 2 soft silk. You think that maybe that was an accent? It was a South Georgia accent problem? Yeah. All right, lyrics for 300. She pulls back onto Main Street in her new Mercedes Benz. The road. Oh, this is supposed to be a Dr. Rowe song. This is an easy one. Symbol. No, you missed some. Close but no cigar. I'm disappointed. All right, time's up. The road goes on forever and the party never ends. Yeah, significantly. I don't remember who had control, but it doesn't matter.
You just don't know how many words. It goes on.
All right, 200 points. Finish the lyric. It's time to begin, isn't it? I get a little bit bigger, but then I admit I'm just the same as I was. Now, do you understand? Hear this with Dr. Giles a lot. I guess I should put the artist. I didn't think this would be that hard. Anybody?
Most of us are paying attention to the OR.
Imagine Dragons.
All right, everyone's up. Now, do you understand? I'm never changing who I am. It's the Imagine Dragons song. It comes on very frequently. Sorry, y'all don't. You can't multitask.
There's only like 2 people in the room that can say a lyric. That's like you two.
Yeah,
Everybody else has to hear the song.
maybe. Okay. Well, at the end of 2 rounds, the scores are Team Triangle with 2,300, Team Symbol, the loudest team, with 1,600, and Team Tambourine, Chief Team, the Tambourine Chiefs with 3,600. So how this will go next, I need you to give me your wager on the Final Jeopardy topic. The topic will be chicken salad recipes. This will be a topic on how to get out of a sticky situation. Not about how to make chicken salad when you're given inferior ingredients to do so. So this will be a bad situation to find yourself in the OR and how you get out of it. So think about what you want to wager. Again, here's your point totals. And you want to write those down for me on something. I should have already. Yeah, you got one.
That would have been a good age procedure.
Oh yeah, I was pissed off that y'all didn't have a high procedure.
I didn't think of that one.
Grundleplasty on that.
Yes, got it. No, actually, it doesn't have to be. All right, let me know when your wagers are in. So everybody figure out, and then you can give Dr. May your point totals. Oh, thank you. I'm going to. All right, everybody ready?
Here you go, whatever.
Okay. So, the final Jeopardy question is, what are the 3 tubes used in triple tube therapy for a perforated duodenum? Oh yeah, you do. Take your things back. Sorry.
Make sure I don't mix them up.
Yeah. Just figure out who's who. Hey, forgot. Yeah, write your answer on there and write your team. All right, everybody get your answers in. Okay, so where's the symbol team?
Simple team is team.
Team 2?
Yep.
Because you're in last. So, Team 2, symbol team, has answered jejunostomy tube, gastrostomy tube, and duodenostomy tube. They wagered 598 points. That is correct. Which would bring them to, here, figure out the math, 1,600. That should be 2198. Team 1,
There's no chance they're gonna win.
Team 1 also selects gastric tube. I'll take it. Jejunostomy.
Whoa, don't be taking me.
It's a tube in the stomach. Gastrostomy would be a better word, but I'll accept it.
Supposed to be doing
That could be an issue.
Oh.
So that's a gastric tube.
Well, they're not going to win anyway. They either have 4,300 or 300 points. And the chief team has wagered 1,001 points with gastrostomy tube, jejunostomy tube, and duodenostomy tube, bringing them up to 4,601, and they are our champions.
As it should be.
As it should be. Strong work. All right, well, thank you, everyone,
Hey, hold on, everybody. Where's
for
Domingo?
Jeopardy. That's all we got. Yep, go ahead.
So real quickly, the crawfish boil was scheduled at my house on Saturday. Y'all get ready for the booze. We're moving it to Sunday. It's supposed to be an inch of rain and high wind Saturday, and that's not going to be any fun. So Sunday, hopefully